Welcome to Physicians Keepers. Each episode features honest conversations with physicians, sharing moments that shaped them, challenged them, or taught them something worth passing on. These stories come from every corner of a physician's life: the clinic, OR, family, finances, mental health, leadership, and personal growth. If a story can help another doctor feel seen or strengthened, it belongs here. It's about honesty, courage, and community true storytelling. If you are looking for connection or a reminder that you are not alone in navigating this profession, you are in the right place. Hello and welcome to another episode of Physicians Keepers. I'm really excited to have you all here today, and I'm also excited to have my guest here today, Dr. Mai Shimada. Thank you so much, Dr. Mai, for coming today. We have a very great discussion to talk about today, and so I'm just going to go ahead and quickly read your bio so we can get into the meat of our discussion. So Dr. Mai is a double board certified physician in emergency medicine and clinical informatics, and the founder and CEO of Mozu Health, which is an AI-powered platform transforming behavioral health. Drawing on over a decade of clinical experience and postdoctoral research at the Harvard John A. Paulson School of Engineering and Applied Sciences, Dr. Shimada founded Mozu to solve the unique complexities of mental health documentation where context and longitudinal relationships are critical. She was born in London and raised in Japan, and she earned her medical degree from the University of Tokyo before practicing emergency medicine in the United States for over 10 years. Her frontline experience in the community ERs during the COVID pandemic-19 served as a catalyst for her pivot towards mental health advocacy, eventually leading to the launch of Mozu Health. So this sounds pretty awesome, Dr. Shimada. Now, this sounds like a huge pivot, right? So you started in emergency medicine, and now you're in the mental health sphere. Now, what has that journey looked like for you?
Yeah. Well, first of all, thank you, Ali, for having me on this show. I'm very excited to be part of this initiative. In terms of my transition from the emergency medicine to the world of mental health, just as you say, it's a pretty different worlds, right? Emergency medicine is very much focused on the physical health, where we really intervene things right on the spot as opposed to mental health.
Yes.
Yeah, quite the opposite. But because I was operating in a quite different space, that made me realize even more of the importance of the mental health, I think. Especially around the time of the COVID pandemic, I was practicing in the community-based ERs in Northern California. And we see, back-to-back patients for COVID, mild to pretty severe cases of it. Yeah. And we needed to decide on how to intervene during the time, which is really rough for many of us clinicians as well as for the patients. And around the time I realized that what we are doing in physical health has a lot of limitations. Evidence-based medicine, great. And by prescribing this medicine versus that one, we probably can increase the survival rate by, maybe 0.1%, or that also is needed. But at the same time, what fundamentally really changes the patient outcomes, it really comes down to their mind.
Yeah, absolutely.
So when I realized that, I wanted to explore more in the field. And around the same time, being in Northern California, I worked with many patients who were struggling with substance usage. And that also accompanied many of the mental health conditions, depression, anxiety, PTSD. And I noticed that the patients keep coming back to ER because they have nowhere else to go. That made me think about what we can do as an ER doctor to improve what we are seeing in the front line of ER for the mental health care. So that was my point. Yeah.
Oh wow, that's awesome because yes, it is, ER, you're trained to think on your feet, you're trained to do things that matter in the now, like get them ready to be safe and send them out like now. But then mental health is long term, right? When people deal with issues with mental health, it's not a quick fix.
Absolutely. Yeah.
It's there's a long, I mean, pretty much a longitudinal course of care that comes with that. And so definitely as an ER physician, you would have seen that. I mean, population wise, people that come into the ER at that time, even though they're telling you, I'm depressed, I'm anxious, and they're giving you all these things, some of those are not emergencies as such. And then there's that gap where you say, well, I can only fix what's an emergency for today. And then the rest, someone else will have to continue that. So that's awesome that you made that transition into that space. So what for you personally, was there any was there any pivot for you that was like, that you got up and were like, well, I think I have to fix this. Like what emotional toll, and this was happening during COVID, right? Where there's so much fear and anxiety and panic going around. Like what shift did that look for you saying, I want to be the one to help with this, like ER is great, but then I see myself being able to help the psychiatrists and everyone that, functions in the mental health space. I want to help them better. Like, what did that look like for you?
Yeah, I think that also, comes back to where I'm coming from. And I think there are several reasons that I got attracted to this field of the mental health care psychiatry, or the intersection of psychiatry and more of the physical medicine. And it may stem from the fact that I grew up in Japan, where this harmony, the idea of harmony in health is pretty prevalent. Rather than completely separating the mind and the physical body, there is this belief that they work in harmony. They're one. They're inseparable from each other. So working in the space made sense to me. And also, as a personal story, when I was in middle school, I had a friend who I was really close with, and we used to play the Japanese archery every day. I was a part of the archery club, and we were really close, starting at age 12, and then when we turned 15, she stopped coming to the practice one day. I didn't really understand what was happening. She just kept going to the school nurse, and eventually she left school without telling anybody. And later I realized that she was struggling with a depression at the time. And a school nurse that she was with told me later that she has caught cold in her heart. That was like special using. And at the time in Japan, they didn't even use the word depression because it was so stigmatized. So I think that that left a really big impact on the way I see health, the importance of mental health. Even I decided to pursue emergency medicine. So I think that really equipped me to really focus on this mental health care, or the convergence of mental health and physical health care later on that comes. So in terms of the focus on helping the mental health clinicians, came from the fact that I worked with a lot of mental health clinicians during the time that I was providing the ketamine-assisted psychotherapy in collaboration with the few hundred ketamine-trained psychotherapists. We were providing the ketamine-assisted psychotherapy in 9 states, and it was really meaningful. It was for patients who were struggling with the treatment-resistant depression, anxiety, and PTSD, and it felt really meaningful in a way that we felt that we were making a real difference to patients' life in a way that that was quite different from what I saw among the patients who were coming to ER for their struggle, right? And along the way, I realized that even though we were making such a big impact to the patient's life, we are always burdened by all the admin work that comes with being in a private practice, independent practice. Yeah. So we started creating a tool within our organization. I like to, play with the tech tools myself as a nerd. And my
Yeah.
brother is an even bigger nerd than I am, and he has been in technology field. He previously co-founded the tech company in Japan. He was kind of looking for next things to work on. So I jumped into my project of making this tool for the clinicians. So we kind of
Yeah.
integrated our product within our clinic originally to
Yeah.
help with our own the operations of the clinic as well as our partner clinicians, and realized that there is such a strong need for such tool to be
Yeah.
incorporated, especially the ones that's being made by the clinicians,
Yeah.
not by people who do not understand being a clinician. Right?
Absolutely.
So yeah, I think that that's when I decided to really focus on mental health.
That's awesome. I mean, it's a family-run business as it sounds. So no better people to run a business with them and family. I mean, you hit a lot of important points, especially when it comes to mental health. So I'm primary care, and it's one of those things where I can, I can try to focus on the blood pressure, why it's not well controlled, or the diabetes, why it's a problem, and try to prescribe as many medications as I want to. But if someone is not in the right space mentally, it doesn't matter what I do to control their physical health. Like if you're depressed, you could basically care less about what the next day looks like. And so then there's no motivation to take your meds. There's no motivation, and that factors a lot into patient compliance, right? Someone's not compliant and you're wondering, okay, why? I'm giving you your meds. Why is this not working? But it's like they can't even comprehend what their physical health should be because they're struggling mentally. And so understanding that there's not just one side of a patient, right? There are many sides, Annie. Like you mentioned in Japan, it's like, when they mentioned the heart was cold. I love that expression. It's like her heart, was cold because even though we think of the heart as a physical organ, but then there's this other side of it, right? Where if everything is not in harmony, right? If the mental health, even for us coming from like for me, I would look at even the spiritual health is not in harmony, then I don't care how many medications you prescribe. It's the mind. The mind has to be right for everything to work out right. So this is mental health is such a vital part of patient care, and I'm glad that through your experience you're able to say, okay, I need to step in, and said, like you said, importantly, from a physician standpoint, right, creating the tools, because the necessary tools that are needed. This is not being created by someone who has no clue what would be beneficial. So that's pretty great. I'm from Nigeria, and same thing, depression was one of those things that we don't talk about. It's like you have food to eat, yeah, you're okay. Like you have a roof over your head, then you should be fine. Like you're not depressed, like you're not anxious. So I do understand coming from some societies that mental health is not something that they focus on, but it is such an important that part of a patient that we cannot neglect it. Now, starting a company is a big shift from clinical work. What fears or uncertainties did you have, or did you have some entrepreneurial skills that made you feel like, hey, I can start a company, like I can run this and I feel like everything's going to be great? Or was this all new for you?
That's a good question. I think as a physician, we are all kind of the entrepreneurs, I think, in some way. We
Yeah.
make our own decisions and things, right? So, by starting the companies are quite different from being a clinician, being part of the organizations, right? So it was a big shift for sure. But I think I was more excited about the potential of being able to create something meaningful
Yeah.
than worrying about what happens if it fails. I think I tend to be pretty optimistic, so things will work out. If not, well, I'll come up with something else. So the leaving the physician salary is a big shift for sure. But I'm a pretty minimalistic person, so Yeah, I think it helped to make the transition. My brother co-founder, this is his second company. He
Yeah.
built the company he built was one of the bigger tech company in Japan. So he had an experience as a CTO. So I think we kind of had a complementary skill. So yeah, I didn't start all by myself. I was supported by my brother, so as many people I met along the way. So yeah, I think it's really that. Yeah, like I was fortunate enough to be able to meet those people who really understood my mission and really supportive of my commitment to reach the goal of creating this tools and make it available to a lot of people. So yeah, I think even for things that's kind of scary as a one person, when you have a team to work with,
Yes.
yeah, I think it feels doable.
That's out there. Everything you said was true. There's something about being in a tribe of people who get you, who understand your mission, who, and like who have experience too. Like say your brother had experience running a company. And so there's that certain amount of, okay, he knows what he's doing on this side. I just need to show up and bring my A game. So that's very important. And, being partnering, social capital can never be underemphasized. Sometimes I think there's a saying, and it says that if you want to go far, you think if you want to go far, don't go alone. Right. And so if you want, depending on how you want to take your company, so this for any physician listening, chances are someone else has the skills that you're looking for. So just, you may not have all the tech skills put together, but if you have a vision, try to look for someone. We may not be as fortunate to have a family member as Dr. Mai has, but there may be someone who has the skills that you need to take your vision to the next level. Now, my other question for you would be, of course, from a documentation standpoint, many physicians feel overwhelmed. That's a big cross that we have to carry, the documentation. What makes mental health documentation uniquely complex? Because that's where most of health focuses on the mental health aspect, right? What makes it so complex that you decided that this needs its own innovation in terms of AI documentation?
Yeah. So in mental health care, especially for psychotherapists, the clinical conversation, that's always happens in the form of delivering the care, right? As opposed to in more the physical health medicine, like emergency medicine, for example, we do a lot of things with hands, procedure, etc. So accurately describing what clinical care is being delivered purely from the conversation, and also documenting how the patient responded to that purely based on the conversation. That's really a unique challenge in a behavioral health care, I'm understanding. So that's why the specialized tool for behavioral health, mental health is really needed, because for general medicine, there are other things that happen outside of conversation. So they kind of directly fit into the EMR that we're using in the formal documentation. Not a case of behavioral health. It's strictly based on the conversation that you're having with the patient. So that focus is really important. And also because of the limited laboratory or other objective measurements in psychiatry, the rejection rate from the payers for behavioral health clinicians organization is higher compared to other form of the medicine. So that's why, the audit-proof documentation is particularly important. And we are speaking in a time that many payers, insurance companies have already adopted AI to screen, to review our claim submission, right?
Yeah.
So if it's machine who is reviewing our documentations without the help of the machine, it's really hard for individual clinicians to fight against it. So I think we are in a really critical moment to create this AI tools for the clinicians to be able to accurately describe what we are providing to the patients and how the patient responding in a way that is compliant with the guideline published by each of the payers, which is pretty complex. So that's why there's a lot of friction between the clinicians and the payers. But conceptually, as long as we do that, create a document accurately describing what's happening in the clinical care according to the payers' rules, there shouldn't be so much of a friction between the clinicians and the payers, right? So solving that is really what we are focusing on. And I think that's particularly important for behavioral health for the reason that I mentioned.
Oh, wow. That's, I said, mental health documentation. It is pretty unique, like you said, because there's a lot of conversation that takes place, and your measurements of a patient's status is conversation-wise. You're not doing any physical exam. I mean, you can look at the person physically and objectively say, looks angry, looks mad, looks depressed, but then as much information as you're going to get from that person is what they say. And then if you have someone who's talking 50 words per minute, or, it'd be hard to keep up, or even document from a conversation standpoint. But then if once you have a tool like yours, you're not, something you can always say, okay, I know that every conversation, like this conversation it's being collected. And, even if you're going back and reviewing it, you can say, oh, this was said. Maybe I didn't pick it when it was being said, but now I can look back and then being able to match with what is actually needed by the payers to code and to bill, which is always a pain for every physician. That's why we have those, monthly coding meetings, billing meetings, and it's like, hey, you didn't meet this, you didn't meet that, and then, it's a point of frustration, for many clinicians. So I do see where this would be such a great tool for mental health providers, where they can focus on the patient, and that conversation, and worry less about, did I get that? Did I write this down? How did this fit into my EMR or things like that? So that sounds awesome. Now, there's a lot of concern about AI in medicine, right? And I'm sure that you've heard a lot of people try to push back against AI. How do you see AI supporting, and that's where I'm coming from, and not replacing the human side of care?
Yeah, that's what we are really focusing on. Basically, we have no intention of replacing clinician. I don't think that's good for the patients. But we need more help from that AI for the clinicians to be able to deliver the care better, more effectively. So that's why we have been focusing on. So I think, the example that I made earlier about payers already incorporating AI just to process the claims. I think, that puts a lot of pressure on the clinician side to need to adopt the AI, right? So I think from an operational standpoint, it becomes inevitable for the clinicians to adopt AI in a way that's ethical. And makes sense for the improvement of the patient's care. So that's where I'm coming from. And what to say? Would AI replace clinician? I think there are some companies for claiming to do that, but again, there's a very strong human-to-human connection component, especially in behavioral health care. And I don't think that's limited to mental health care either. When I think about the cases that I had in ER, patients who somehow survived, where I didn't think they will make it, they tend to have had a strong rapport with the clinical team, including myself. So I think that component is really, really important in any part of medicine, and that cannot be replaced by machine. Having said that, for mental health care specifically, there is a big shortage of the care providers, and especially in the remote areas where the number of the clinicians, mental health clinicians, are limited. It's really hard to access any form of the mental health care, right? So in such situations, having some support to navigate such shortage, where maybe small number of clinicians they who used to be able to see 30 patients a week, now they can see maybe 5 extra patients with technology, maybe not just one-on-one conversation, but by the use of technology to have that more text-based communication, for example. So I think those are the directions that this technology is headed to, and I believe that will be beneficial for patients.
Yeah, absolutely. I mean, AI is a tool, right? And as with every tool, it's if you use it right, it can enhance what you're using it for. And so in this setting, it can definitely enhance patient care. And so, I'm on, the Mozu website right now, and it pretty much breaks it down what it's for. It says that, it tracks a trend across sessions. You finish your last session and you go home, which for every physician is awesome. No backlog, no weekend catch up, just the work you love, being sustainable. And you do have an option for clinicians to try free, right, and see what documentation feels like when it's built for behavior health. So I take, and it looks pretty amazing just viewing it. So you all did a great job with this. So this looks awesome. And I guess I would definitely look to trying it. I did see that for like a solo physician, there's an option for a free trial with that. So I would, most of my patients are like a mix, but then I think for a mental health patient that's coming in, I know that visit is strictly going to be dedicated to that. This would be a really great resource, and I can't wait to get back to you to tell you how it actually helps. So thank you so much. Now, are you completely, do you practice clinical medicine at all?
No, really. I sometimes help out, but yeah, I've been focusing on mostly health 100%.
Okay. How did this transition for you affect your sense of fulfillment? Because a lot of physicians, they, even though they feel like I need to do something different or I need to do something more, there's that string that keeps tying them to, well, I don't know that if I feel fulfilled, if I leave, clinical medicine, and so there's that attachment where they don't want to cut the strings, or they don't know how to free their mind to do other things because they think, okay, I spent so much time in clinical medicine, will I still fulfilled? So tell me about your experience, like your sense of fulfillment, leaving clinical medicine. What does that look like for you?
Great question. And this is why, I still work with patients that through my private practice. So yeah, I'm not, in some way, I'm not fully, have lost touch with the clinical care. I really enjoy the part of my day that to work directly with the patients. So having said that, I think, reframing what I can do as an individual from a clinician to more of this the managing an organization to provide the tool to help other clinicians is quite different. But in reality, I work with many clinicians who are providing cares to their patients, and they do such an amazing job taking care of their own patients, but they struggle with those admin piece, so that we help out so that they can deliver the care in a better way, more effectively, without burning themselves, right? So yeah, working with those clinicians has been really fulfilling to me, to be honest. So yeah, even the number of the patients that I see on a regular basis is a lot lower compared to before I started this company. But yeah, seeing my fellow clinicians thriving in their practice by using our product, that's the greatest joy that I can have. So, I think it's really fulfilling for me. So I think finding something that really is aligned with your body, like what really excites you, what makes you feel fulfilled. I think identifying that is really important. In the case of me working in the field of the behavioral health, somehow improving the field as an emergency medicine doctor, and getting to where I am. I think that was somewhat inevitable.
That's that. But I mean, I love that you said, you still said you still try to keep in touch with the patients, but then you find fulfillment in this area, which is key to just your human experience, right? Because no matter what you're doing, you want to be able to look back at what you've done, right? And everything, the work when you go to work every day and come back at the end of the day and feel fulfilled. You know, that what you're doing is changing lives, it's meaningful for others, and it doesn't necessarily have to be in the four walls of clinic or in the ER. You know, it can be just following your passions, following your dreams, you know, executing them greatly, and then seeing the impact in other people's lives. And that's as much fulfillment as, you know, we can get in life. So thank you so much for sharing that. Now, what this pivot that you made, what did that teach you about physicians who are stuck in their current roles? You know, so if you were talking to a physician who feels like they can do more, but they feel stuck, what mindset would you have them approach to get unstuck, so to say?
Yeah, that's a really good question. I think having the space and time to yourself to really reflect on what's important to you, I think that's really important. When we are practicing in the hospital setting or clinic setting, day to day happens so fast that, you know, we are always executing things, right? Make things happen. And we really don't have time to stop and think about what's really important to us, what is really aligned with us. And I think having that is a starting point to make the changes that matters to your life. So I think taking the courage to have that pause, maybe just one day, or maybe just one evening, or you may go into a silent lecture. I don't know what the exact form that will work for you, but I think having the moment of pause to be able to really reflect on what's important to you, I think that's a starting point.
Yes, that's very valuable words of wisdom, right? Because sometimes you're so caught up in the grind, right? That it just becomes monotonous, right? Same things you do over and over again, and then you're exhausted, and you know, so finding that time to just stop, reflect, and think, okay, is this the direction I want to keep going? Is this sustainable? Or do I see a different path for myself? And is this going to be, am I going to feel like I'm more fulfilled in this area? Or is what I'm doing, you know, giving me enough fulfillment that I need, that I don't need to do anything else, you know? And this is, when I'm talking to physicians, this is not to say that we expect everyone to pivot, right, from clinical medicine, because, I mean, you didn't completely. You just found your niche. You found what brings you joy in this setting, what brings others joy, what makes you fulfilled, and then you went ahead to pursue it. So great words of wisdom today, Dr. Maya, and appreciate it. So do you have any other thing you want to share with our guest today? Where can they find you if someone wants to go look for your products? Like, how accessible is it? And just give us all your deets so that we can find you if we want to.
Yeah, sounds great. Our product Mozu by Mozu Health is available on our website at mozuhealth.com, mozuhealth.com. And it is free for solo practices or the first clinician in a practice. So yeah, give it a try. And my hope is really to co-develop this product with our fellow clinicians, fellow physicians, because I think we're in a pretty critical moment in this AI development coming into the clinical operations. And think about how our clinical IT system that we use now, that was made without doctor's leadership, right? Yeah. EMR. Who loves our EMR, right? So I don't think, I don't want that to happen with this new, generation with the technology that's coming into the market. And for that, doctor's input is really important. Physician's input is really important. So that is very important for us as well. So I would love you to give it a try at mozuhealth.com. And feel free to email me directly. My email address is my@mozu.health. And I'd love to hear from you anytime.
Awesome. I'll put all that information. And I mean, you spoke to every clinician when you talked about those EMRs were not created with us in mind. Because I mean, I know I don't want to learn 50 ways to do one thing. I don't know. Just
Right.
tell me one way to do one thing. I don't need to know that there are 10 different ways to do it. And so, absolutely, there's that fanfarism that comes with EMRs that didn't have the patient and the physician in mind. I mean, we want easy, we want good documentation, but to make it easier and less of a mountain for us to climb with those. So I'm glad that Mosu Health with you, as a co-founder had that in mind, and hopefully, it'll be a great tool for every physician, especially in the mental health space, who decides to go ahead to use it. Well, Dr. Mai, thank you so much. It's been an awesome pleasure having you on today. You've been an amazing physician's keeper. You have exemplified what it takes to be a physician's keeper, looking out for your fellow physicians by stepping out of ER and going into the mental health space and developing this amazing tool to help those in the mental health space. So appreciate you. Thank you for coming here today. If you are watching and you have an amazing story that that another physician will benefit from, you can reach out to me, drremla@gmail.com. I'll put all the links in the show notes. But we look forward to having you here another time as we hear from another amazing physician's keeper. Thank you, Dr. Shimada. Appreciate you for coming here today.
Thank you, Ali.
Thank you for listening to Physicians Keepers. I hope today's conversation gave you something useful to carry into your life or practice. If it resonated, share it with another physician who might need it. And if you have a story that could help someone else, I'd love to hear from you. Connect with me on social media or send me an email. See you in the next episode.